I reported just a few weeks ago on how a nationwide shortage of teachers is impacting local school districts. There is another national shortage that's also impacting local schools.
News Channel 3's Peter Dowd is here now with an in-depth look at how a nursing shortage is also taking a toll on schools, including right here in our valley. And Peter, many are calling this a growing crisis.
That's right, John and Karen. The role of the school nurse is more critical than ever, with a quarter of all young children suffering from some kind of chronic illness, like asthma or diabetes. So I looked at the number of registered nurses in each Valley district, and all three of them say they would like to have more.
I can't say enough about the nurses. They've gone above and beyond what I ever would have expected as a parent.
Estela Lopez is the mother of 3 children who have medical conditions. She says all 3 depended heavily on PSUSD school nurses.
From early elementary all the way through high school, all 3 of them had needed services at one point or another, from minor things to very more challenging health issues.
But nationwide, the need for school nurses far outpaces the supply. Right now, 40% of U.S. schools do not have a full-time nurse, and 25% have no nurse at all. So why are so many school nurses leaving their jobs? According to the National Association of School Nurses, reasons include inadequate compensation, misconceptions about their role, and too much job-related stress. There are no federal or state laws regulating school nurse staffing, but the CDC's national recommendation calls for 1 nurse for every 750 students. Most states, including California, fall short of that. At all 3 Coachella Valley school districts, nurses juggle multiple schools at a time.
They kind of rotate throughout the district depending on where the needs are at.
Laura Dyson is PSUSD's Director of Health Services. She says the district currently has 16 school nurses for its 27 schools and more than 20,000 students. In addition, there are 9 licensed vocational nurses and 21 medical assistants, making sure every school is covered at all time. Dyson says she's satisfied with those numbers, but
If the board came and said, we want to give you 5 more nurses and put 1 in every school, I'm not going to turn it down. I would be happy to do that.
This issue is very concerning for me.
At DSUSD, lead nurse Susan Cadle says the district currently has 12 school nurses, 10 LVNs, 5 special education health technicians, and 4 health technicians at each high school.
We always advocate for more nurses, but we are currently staffed at the levels that the district has approved us to be at.
What are your biggest concerns about the lack of nurses?
So my concerns would be that we have students at school that need healthcare procedures that we don't have enough staff to take care of. Now, with that being said, we are currently not in that position, but that would be my fear, is not having enough nurses who have the experience and knowledge that's needed to take care of some of these very sick kids at school.
The district has a large recruitment budget, but Cadle says getting qualified nurses to apply has not been easy. How concerning is it for you that you're seeing a decrease in applicants wanting to be school nurses?
It's very concerning because I feel like our student population is coming to us with more and more and more healthcare concerns. And so having qualified professionals available to those students is really a key part of their whole educational process.
At CVUSD, the district currently has 6 school nurses, 7 LVNs, and 21 health technicians at every school. The board recently approved hiring 3 more nurses, which would bring the total to 9. Do you think there are enough nurses in your district?
Right now, no. We're seeing more food allergies. We're seeing more diabetic students. Our special education classrooms are growing every year. And we're seeing more needs, and that's taking up a lot more of our time.
Meanwhile, Estela Lopez says the nation's shortage of school nurses should be a big concern for everyone.
Children need to be healthy in order for them to be good students. And if we can't support them in that way, then what are we going to expect when they leave school? How can we expect them to be productive members of society?
Right now, there is an assembly bill working its way through Sacramento that would allow LVNs and not just RNs to become school nurses to help deal with the shortage. Meanwhile, this February, the California School Nurses Organization is holding its annual conference in Rancho Mirage. So Valley districts are hoping that event will be an opportunity to do more recruiting. John and Karen?
So Peter, what are some of the solutions for Valley parents who may have children with these health issues?
Yeah, good question. First and foremost, they need to talk with their kids' school and let the staff know about any medical concerns. Again, if a school does not have a full-time registered nurse on site, there are LVNs or health technicians who are trained to respond to an emergency. The key, of course, is communication and making sure that someone is always at the school to help their child if needed, and also making sure the child knows who to go to. For more information on the need for school nurses, including links to national statistics, head to KESQ.com. Live in studio, Peter Daut, News Channel 3.